The content of this podcast is based on medical fact and evidence-based practice from credible, authoritative sources, but is not a substitute for your institution's policies, procedures, common sense, or good judgment. The views and opinions are those of Eric Bauer and Flight Bridge Ed in their entirety.
Today, our deep dive into the FAST archives is a talk from Ritu Sahni, a voice that should be very familiar to you. Ritu is not only the EMS Medical Director for Clackamas and Washington counties in Oregon, but he also has a wealth of experience in public, private, and hospital-based EMS, as well as critical care transport. He's an emergency physician and a longtime advocate for EMS, chairing the Advocacy Committee for the NAEMSP, among his other accolades and appointments. In his talk, Equity in Emergency Care, what does that even mean? Ritu dives into the critical role EMS plays in public health and community care. He challenges us to consider what it means to provide equitable emergency care and how we can ensure that everyone in our community receives the help they need. He's a friend to us and to the wider EMS community, and we're excited to share his insights with you. Let's get into it.
All right, everybody stand up. Let's go, stand up. We're going to play a game. I need you all to move to that side of the room. Let's go. We're going to get the juices flowing. You guys ever play red light, green light? Did anybody watch Squid Game? We're going to play that kind of red light, green light. There's a little turret right there. Very cool. It's good. The line is not completely straight. I like that too. Okay. What I need from you all is some characteristic about yourself or about something about life that you either can't really change or didn't know that choice made a difference. Like eye color. That's a great one. So if you have blue eyes, take 5 steps forward. If you lied about your blue eyes, take another 5 steps forward. If you have brown eyes, take 2 steps forward. All right, somebody give me something else. Now, some other different characteristic. Hair color. If you are bald or getting there, take 10 steps forward because clearly you're smarter than everybody else. Great. Stop. All right. If you are wearing a ball cap, take 3 steps back. Oh, my goodness. Oh, my goodness. If you're over 5'10", I'm only 5'5", you're taking 2 steps back. Oh, wait, the man has some power here, right? If you're below 5'10", take 3 steps forward. If you're 6 feet tall, take 5 steps forward. Oh, yeah, it's pretty unfair, isn't it? Yeah. Yeah. Age. All right, if you're less than 20, no, that won't work. If you're over, well, I'm 56, so, 55. I'll be 56 in a couple. If you're over 50, take 2 steps forward. I didn't want to call people out, though, all right. We're going to do a few more. We're just trying to get through 20 minutes of playing the game is what I'm thinking. If you wear glasses, take 3 steps forward. If you wear contacts, take 5 steps forward. A lot of contact wearers here. If you flew to Vegas, take 3 steps forward. If you drove to Vegas, take 2 steps backwards. There are some people who haven't got a chance, are going all the way through the wall, huh? If you're wearing shorts, this is a conference, take 2 steps back. If you're wearing a sweater, take 3 steps forward because you knew because it's going to be you're a good planner. If you were born in Texas, take 5 steps back. If you have a beard, says the guy with a beard, take 3 steps forward. All right. So you guys enjoying the game? All right, so take a look around. So is everybody in the same spot? The goal of the game is to win, right? Or the goal of the game is at least to reach the goal. And let's say the goal is to reach this line right here. So when I look at my friend Alan Wolf, who's standing right there, how much effort or does it take for Alan to get to here? One step, right? What about the person who's way in the back, the young lady who had to move backwards? What is the effort it's going to take to get her to the goal? A lot. Think about that as we talk about this issue of equity, in particular, and equity of care. So let's say that this goal is what? Think of an equitable care goal. Cardiac arrest survival. In our systems, you want cardiac arrest survival to be maximized. When you think about your patient population, are they all starting at the same spot when you get to them? Or do they have different sized journeys to get to the goal? This is the interactive part. It's all different, right? So let's also talk about these choices that we all want everybody at the same goal, right? But the choices that we pick, or the characteristics we picked, who here can pick their hair color or their eye color? Now, theoretically, in the future, we'll be able to do that. I don't know. Brandon made the joke about Texas, right? If you're born in Texas. But if you're born in one of the 10 states that are in one region of the country that have a much higher infant mortality than everybody else, does that give you steps forward or backward? Backward, right? If you are raised in a community that has terrible schools and want to become a paramedic, what is the framework of science training that you have to fall back on once you go to paramedic school? Is it better or worse than the person sitting next to you? It's probably worse. You know, my kids are kids of privilege, unfortunately, or fortunately. But my son and daughter, they went to a really good high school. I paid for college prep classes, and I paid for a college coach to get them into college. And my boys still end up going to the state school. That was weird. The kids 2 school districts over, they don't have that opportunity or that chance. So when we talk about diversity, equity, and inclusion, the term equity is supposed to demonstrate the journey that it takes to get to your goal. Okay. So again, our goal is that we want everybody to get here. So this is no longer a competition. I don't need you in the back to beat Alan. I want everybody to get to this line. So now, what would be some techniques to do that in the scope of this game right now? Pick a characteristic that everybody has. If you're human, take 3 steps forward. Great. Look at all you. Okay, I'm going to go look in the back here. If you're wearing a blue hoodie, take 10 steps forward. So now all of a sudden, I've taken a characteristic that I've identified starting out in the back that is able to move them closer to the front. So you guys get the idea? So when we talk about equity of care and equity of outcome, we're not talking about making sure that everybody gets the same thing, because not everybody is starting the race at the same spot. What we're talking about is making sure that everybody ends up in the same place, regardless of how they started. And that is a very distinctly different mindset than just saying, you know, we're going to treat everybody the same. So there have been a number of studies that have looked at equity of care and equity of outcomes in multiple populations. And you'd be surprised to hear that when you look at things like pain management by ethnicity and race, that the line, the outcome, which is the act that we want, which is that everybody with pain gets treated for pain, that there's a difference in that outcome. And we did that study. A friend of mine named Jamie Kennel, you can Google Kennel et al. He did his PhD thesis on that topic. And now he consults around the world talking about these issues. We brought him into our system to look at our equity of care. Here's the stunner. We found out when it comes to pain management that there is a difference in care, an outcome, patients receiving pain medicine based on ethnicity group. All right. And that's, again, not what we're about. Now, what do you think the response? So this got huge press when Jamie published this in the Pacific Northwest. He published it with our state's data in Oregon. What do you think the response was amongst the field providers? Was it, thank you for pointing out that this is a problem? No. The response was, everybody's the same in the back of my ambulance. Well, I would point back that if everybody's in the same in the back of your ambulance, then you are practicing equality and not working towards equity. That's really the key, is that we have to stop talking about equality and talk about outcomes and working towards equity. And that was the purpose of this tool. This is a very famous diagram that you see where the equality is everybody stands on the same little thing, but equity is sort of boosting the short person up. Now, the problem with this graphic is that if you go by height, you sort of get this image that the person who's smaller is somehow less than. So I don't think that that's actually true. But the idea is, again, that you look at these outcomes. So there's been a ton of data that showed that cardiac arrest survival is different based on zip code. And if you use that zip code as a marker for socioeconomic status, that we have different outcomes. And why do you think that might be? No available healthcare. So as an EMS provider, when I go to a cardiac arrest, I have the best chance to save VF, right? I have the worst chance to save somebody who's in asystole. Now, the makeup of your cardiac arrest pool is probably related to issues around equity and equity of care. If you have poor access to care, when you finally have that event, the likelihood that it's a pure cardiac event where you go into VF is probably lower. So in some cases, the equity of care issue is not just an EMS problem. If somebody calls 911 with a cardiac arrest and they're Russian speaking, do you think the time frame till identification of cardiac arrest is the same in that population than it is in an English-speaking population? No. It takes time to get the language person line, et cetera, et cetera. Is the 911 call taker purposefully doing this, by the way? Do you think any of our medics in Oregon were purposefully withholding pain medication from different ethnic groups? Absolutely not. Absolutely not. Do we purposely not provide good cardiac arrest care in lower socioeconomic neighborhoods? Of course not. But the point is still that the goal, this line, that getting everybody to reach this line is challenged by different things. And much like the leadership talk this morning, where he talked about sort of individually looking at your people, we have to stop looking at, well, in some of our systems, we have to start looking at outcomes, but we have to stop looking at them just as a system as a whole and start looking at these equity indicators. All right, so one of the questions that I always get is to quote Mickey Eisenberg. Everybody know who Mickey Eisenberg is? He's Seattle, where the cardiac arrest survival rate is actually 172%. If you fall asleep on the sidewalk and they wake you up, they count that as a save. One of the things that Mickey says is that to improve your care in cardiac arrest or in EMS, that you must constantly strive to measure and improve. And so whether that challenge is chest pain or cardiac arrest or pain management, we should not only be measuring and improving as a whole, we should also be measuring and improving through an equity lens and starting to look at the individual patient populations that we may be able to affect by having more individualized approaches to care. Ask that question. Are we providing good care? Are we providing good care to everybody? Are we reaching goals equitably and not necessarily equally? Thank you.
This has been a production of the Flight Bridge Ed Podcast, leading the way in pre-hospital critical care and emergency medicine education.